Welcome everyone to the weekly AgCast Extra. My name is Jennifer Craig with Arkansas Farm Bureau, and I'm here with Craig Wilson, who is Director of Health Policy at the Arkansas Center for Health Improvement. Hey Craig, how are you doing?
Hey, good. How are you?
Good to have you today.
Thank you.
Well, for those that aren't familiar, let's start with a little rundown of the Arkansas Center for Health Improvement and what you guys do.
Great. Yeah, I'm the Health Policy Director. I've been there for nearing a decade now. And the organization itself has been around for a little over 2 decades. And we essentially act as the health policy unit for the state. We work with state agencies, we work with legislators, we work with municipalities and counties to advance health policy that improves the health of Arkansans. We have kind of my team, which is the policy team, and we have a research and analytics teams that they go and do assessments of our large data assets, which are maintained by our data team. And we do a lot of fielding of questions and go and look at the hard data, the empirical information, and then we translate that into information that advances good policy for the health of Arkansans.
Okay. And I'm sure you guys have been working extra hard over the past couple of months with all the information that's coming in from the pandemic.
Extra hard, and we've been working a lot with the university, with UAMS, and as well as with the Department of Health, looking at some of the data that they're collecting and working with them to link that with other information to really be able to identify some of the risk factors associated with those who experience poor outcomes with the coronavirus.
Okay. Well, I know one of the major concerns that people have had, especially within Farm Bureau talking about rural Arkansas, is the status of our hospitals in rural Arkansas. And I know even before the pandemic, there was some concern. So maybe you want to kind of take us back to beginning of the year or end of last year and talk about what situation looked then and then how this pandemic has affected it going forward.
Yeah. So our rural hospitals, which are a part of the rural health fabric, right? The acute care that people need, emergent care that people need. They were in actually considerably better shape than in other states, primarily due to the state's decision to expand Medicaid coverage. It really shored up hospital finances for a short period from expansion when it started in 2014 up through really about 2017 and 2018. So we had 55 hospitals in our surrounding states that closed from 2010 through January of 2020. And we were lucky in Arkansas not to have any closures except for the hospital in DeQueen that closed last year, which, the hospital had some issues that were not really the result of some of the environmental factors. It had some external management that came in and really ran that hospital poorly, which resulted in its closure. But there are a number of hospitals, about a third of our rural hospitals, that are nonetheless struggling financially. And that's a result of a number of factors. Primarily the one is the business model that has been handed to our rural hospitals. Many of them are what's called critical access hospitals. And those are hospitals that are 25 miles from any other hospital. It's a small hospital, no more than 25 beds. And they get special reimbursement through Medicare and Medicaid that permits them to account for 100% of their costs. So they get paid what's called cost-based reimbursement. Okay. But there are a number of things that they have to do to maintain that critical access hospital designation. And that business model was designed in the late 1990s when you had a lot of inpatient hospital admissions. There were a lot of procedures, surgeries that were done on an inpatient basis. So they were able to fill their beds most of the time. Today, that is really not the case. A lot of these hospitals, their average daily census has reduced dramatically. Some of these hospitals have an average daily census of 2 or 3. And when you have 25 beds that you have to staff and you have all these overhead costs, that's just not a really good business model. So the reduction in inpatient procedures is one of the factors that has resulted in about a third of our rural hospitals having real financial distress. A second one is that rural population in Arkansas is declining. Just over the last 7 years, outmigration in rural counties has been at an average of about 2.5%. And in some counties, it's upwards of 10 or 15%. And most of the individuals who are migrating out of rural areas are the younger populations. So hospitals and rural clinicians are dealing with older, sicker populations who may have needs that are beyond what the smaller rural hospital can provide, and they're more often going into urban areas to receive those services. So those are a couple of factors. Also, hospitals and rural areas have historically had problems attracting and recruiting health professionals to those areas. So it's harder to recruit individuals, and so they have to pay those individuals at a premium, or they have to hire a staffing company that charges a premium for those individuals to work in that hospital. So it's a number of different factors that have resulted in hospitals in rural areas operating on really thin margins.
And so do you see that, I know when the pandemic started, not long after that, the governor had some money that was available for these hospitals. Mm-hmm. Is this something that is going to help them in the long run, or was it more of just kind of a Band-Aid for the situation right now, or is it just so hard to tell?
I can say it's an absolute Band-Aid. There have been some models that have been proposed that would provide kind of forward financing or advanced payments on an annual basis or a monthly basis that would allow rural hospitals to really change their business model and right size for a community. Mm-hmm. But the funding that's coming out now is, they're just filling gaps with that funding because they're not seeing the patients that they otherwise would outside of a public health emergency. I've talked with individuals at some of the hospitals around the state, and they're seeing their emergency department visits decline sometimes by half. Some of them own outpatient clinics that help them supplement some of the funding losses that they incur in the hospital setting itself. And of course, those outpatient visits are declining, some by more than half. Now they're rebounding a little bit in the outpatient setting, but it's not enough to really make up for the losses. So, a lot of these hospitals are in a pretty dire situation right now, and unfortunately, a lot of the care that is likely needed. Mm-hmm. That people are foregoing might end up in worse outcomes and in higher costs and more complex procedures down the line. And so I think we're going to see that show up at rural hospitals and urban hospitals just the same because people are holding off on probably much needed care right now to avoid coming in contact with individuals who may be infected.
Are you seeing that? Are we seeing that as more of the patient's decision, or is that hospitals that aren't doing as many procedures that I guess were considered elective?
Yeah, I think in the short term, in April, there was a restriction, a directive through the Department of Health that did not allow hospitals to do at least overnight elective procedures. They've resumed the outpatient procedures that hospitals might do, and you can come in and get a procedure done and leave in the same day. Now they've reopened overnight procedures, I think, for up to 48 hours stay in the hospital. But, some of those more elective procedures were not procedures that rural hospitals were performing,
Right.
the orthopedic type, nips, knees, hips, and shoulders and things like that. A lot of the rural hospitals weren't doing that. So they're doing more the urgent care response and emergent care response.
Right.
So it didn't really impact rural hospitals as much on the elective side. What really impacted rural hospitals were individual decisions by potential patients who might have otherwise come to those hospitals.
Gotcha. Well, moving forward, I know that we really can't predict when COVID will be gone or what we're looking at in the future, but what are some things that you think are going to help ensure that we have healthcare in rural Arkansas? And maybe what are some things that we can do on a larger scale, but also on a smaller scale in those communities that can help make sure that rural Arkansas is still going to receive that good healthcare?
So clearly, on the forefront of the conversation is telehealth or telemedicine, whatever the term is, delivering care via digital means.
Mm-hmm.
A lot of hospitals and outpatient clinics are really scrambling to get the necessary technology and equipment to be able to deliver services to individuals in a remote setting. Clearly, some things you can't do in a remote setting, but there's a lot of migration, a lot of investment going on in telemedicine right now that I think will stick and will carry forward to ensure that a minimum set of services is available for people in rural areas. Secondly, I think that we've got to work with the federal government and the state government on some flexibility for rural hospitals to really change their business model. Maybe migrating from an inpatient 24/7 hospital or 24/7 emergency department that has to be staffed in a certain way, migrating from that to more of a maybe kind of a standalone emergency department that's a kind of a triage. They stabilize individuals with a strong urgent care clinic that's attached to it for people who don't need emergent care. But for those individuals who need emergent care, they can stabilize them and wrap around a good emergency transport system to get folks to the necessary care that they need. And then finally, I think just having good community investment in a hospital and avoiding some of the pitfalls of having an outside management company come in that doesn't have the connection with the community and is there to make a profit. Sometimes just thinking through those things and having the community really invest in the hospital if they really want it there. That's key to maintaining acute care access in some of these communities.
And I think that's key in a lot of things we do in rural Arkansas and these smaller communities is having that investment, no matter what the organization is. If you have the community involved, they're going to, it's going to be something that's going to thrive because they're invested in it.
Yeah.
Have you seen other states that have changed their models that have been successful in keeping their hospitals open in the rural areas?
There's some innovative things that are going on. There's the Pennsylvania global budget model that the public payers, Medicare and Medicaid, have bought into, as well as some of the private payers like the Blue Cross Blue Shield here in Arkansas. And when they all come together and pay on a global budget rather than on what has historically been paid on a fee for service. So the more services that you do, the more you get paid. In a global budget, they look back at your history and they say, well, we anticipate that you would otherwise have this much revenue coming in on a monthly or an annual basis. And we're going to give you that up front, regardless of the services that you do, with the idea that you would invest some of that in transforming the way that you do business.
Right.
And we haven't seen results of that model yet, but it's a very promising approach. Really, what's going to be needed is the flexibility from the federal government, and probably changes in law at the federal level to really make sure that that these types of models can work in rural Arkansas.
Yeah. Well, thanks for being with us today, Craig. Is there anything else you want to add?
Yeah, I just want to reiterate the point that that rural hospitals don't equate to rural health. As I said earlier, the rural hospitals are just a component of our rural health infrastructure, and so investment in prevention and in chronic disease management, and in our primary care workforce, I think is extremely important to ensure that we continue to promote health and have preventive measures that will keep people from having to use that acute care, which is always the most expensive sort of care.
Well, great. I think that's some really good points. Well, Craig, thank you so much for being with us today. I appreciate the information about what we're looking at in rural Arkansas, and I know that there's many people that have a concern about that, because most of our people in Arkansas are in rural areas, and it's good to know that there are being things done to help keep those hospitals open, and looking forward to some things that we can do in the future to make it even better. So thank you so much.
Thank you.